this week I start my Integrative week elective, and so I have 2 weeks where I get to shadow integrative medicine doctor, chiropractor, physio, kind of those allied health workers. And today's my second day. I finished one day yesterday with the doctor that does trigger point injections, and I will be working with her later this week, and we'll get her on the video. Today I'm working with a chiropractor. He's a program kind of coordinator, and he wants me to do my VO2 max test, which is going to be quite intense because I'm going to have to... Oh, there's Nala. Hi, Nala. Sniff the camera. Yeah. Because I'm going to have to either pedal or run, however he sets it up, until I can't go no more to test what my VO2 max is. So stay tuned for that. These next 2 weeks are going to be very fun. Nala, what do you think about integrative medicine? You like it? Is he good? Is he good? Oh, you want my microphone? Oh no. By the end of this video, if you don't know what integrative medicine is, you will. I will talk to you about it. I'll get the definition up so you're aware. Not many doctors know. Actually, like 90% of the doctors or more don't know what integrative medicine is, especially med students or pre-med students. This will be a really cool video. I'm running late. I have to go to the chiropractor, to my wifey and my little poochies. Alright, so I'm expecting to do a VO2 max today. It works out, and I know it's going to be very hard.
Maybe just a little bit less your idea of what effect it is.
Alright guys, it's time for the VO2 max test. I have to change, so I gotta go like this. Alrighty.
I'm going to ask you for a thumbs up or down each time that we're about to increase intensity. The intensity that we're going to increase is going to be either increase in speed or inclination, okay? So we may vary it. Sometimes people will fatigue from not being able to run as fast before their VO2.
Okay.
So we want to find that balance where you'll actually fatigue because of your cardiovascular fitness. And so I'll be doing a mix of both, but I'll let you know what I'm doing. I'll say I'm going incline increase by X amount, increase speed by X amount, and we'll be increasing about every 1.5 to 2 minutes.
Yeah.
Okay? So before the point of increase, I'm going to ask you, Thiago, are you ready for next level? You give me a thumbs up. Some people will give me this when they're about to tap out, or some people will just give me a thumbs down. And that way I know not to increase, or just to end it at the end of that stage.
Is the goal to always want to increase? Because if I give you a thumbs down, that's like pretty near the end, right?
Exactly. Yeah, exactly. So that's the part where I work based on what you tell me.
Okay.
Once we increase speed, it's essentially increasing demand of the exercise.
Yes.
So if your VO2 is higher, then theoretically you should be able to perform at that new demand or work rate that we're choosing, right? So that's how we stress your cardiovascular system additionally by increasing the intensity of the exercise. Does that make sense?
Yeah.
And what we're going to do is I'm going to take our time spreading it out because I want a nice big graph, right? So we want a lot of stages because I want a pattern like this. So first thing, we just want to do some fitting. Take a deep breath in. Where do you feel the air coming up from?
I'm so tired. I lasted just over 20 minutes and pushed until I couldn't go anymore. we're gonna go over paperwork right now, or the results. He's gonna explain it to me.
This here is my favorite part of it. Well, my second favorite part of it. These are the zones we were talking about, right? So at the start, these were the metrics that we began at.
Yeah.
VO2 max, right in here. So essentially, your VO2 max is the amount of oxygen that your body can utilize during graded intense exercise. Right? So the higher the VO2 max, essentially, the more oxygen you're extracting and utilizing as your intensity is going up. You may recall maximal heart rate.
Yeah.
Right? The estimate is 220 minus age. So when we look at the maximal heart rate that you got to, right, 152. Although remember we had the bit of the glitch in yours, so yours got up to about 170.
Yeah, that's normal.
Yeah, but if you think about that, 220 minus your age, what would be your theoretical?
It's like 190 something.
Right.
Yeah.
So you see that potential that should still be there. In fact, I've had people hear that their max heart rate should be like 195.
Yeah.
And they're going at 205 beats per minute. But these are professional athletes.
Okay, so you're saying, let's say 170, I still have like 20 beats that I could use.
I'm using quotations around that,
yeah.
right?
More fit.
So your limiting factor wasn't necessarily anything except the lack of oxygen and energy available to the muscles.
Yeah.
You can think of it that way, right? So once we have this information, the VO2 score itself, yeah, it's important, but this is not really what I'm interested in when it comes to performance.
Okay.
Because the VO2 score is also heavily dependent on how much muscle mass you have. The more muscle you have, the more oxygen that's being utilized.
Yeah.
So you can't really compare your VO2 max to someone that's like your height and will say 60 pounds of muscle more than you.
True.
Right? It wouldn't be a fair comparison. But this here, this is really what matters. Right? Oh, you actually got up to 182. Yeah, so that's the highest you got up to. So that's pretty good. So this here, I had to shorten it just because we were running out of time. I would have liked to have done more steps. But essentially what this is showing is the substrates for energy that your body was preferring during each different stage of exercise.
Oh, that's cool.
So for example, at stage 1, which is, typically aerobic metabolism, you're utilizing almost all fat. Now notice that it's a little higher in carbohydrates. This is heavily based off heart rate as well. So typically we'll see some carbs and then it goes down like here and then it starts to go up again. Yeah. This right here, this is what defines fitness to some extent. Okay. Because when we're using purple, which is fatty acid oxidation for energy, this is your quickest available energy. Right? What defines somebody as an athlete or having very good cardiovascular endurance is someone who can utilize fat at higher heart rates. Okay. Does that make sense? Mm-hmm. So I'll give you my example. I did mine and I compared it to a professional soccer player. Same height, almost the same weight, and his VO2 was, we'll just call it 2 units higher than mine. So he looked at it and he said, "Man, Rich, you're in good shape." I was like, no. Let's look at this now. Right? The VO2 was deceiving. I had more muscle mass than he did. Oh, okay. But when we look at this here, my fat distribution ended at about 150 beats per minute. Yeah. He was peaking at fat oxidation at like 170, 180. That's the difference between him and I. Mm-hmm. That I, at 180 beats per minute, I would have lasted maybe 5 minutes, if that. Yeah. Versus that particular individual was running at 100 beats per minute, and they were just getting started. Oh, jeez. Right? That's so the difference. Yeah, efficiency. And so when we promote this test, right, those are the two sort of populations we're trying to work with. Athletes who are trying to improve this oxidative capacity, or someone who is like diabetic, metabolic dysfunction, insulin sensitivity. This fat distribution is like minimal. Yeah. So we want to prolong this and we want to push this. This is a reflection of mitochondrial function. Okay. Right? That's where fatty acid oxidations occur. Sure. Right? So this is a reflection of mitochondrial function. And that's what we want.
That's key to longevity.
Absolutely. Yeah, that's exactly it. So that's how we use this test. Now the rest here, remember how I mentioned to you that this becomes your personal trainer, right? If we want to improve our zone 2, which is our aerobic metabolism, this is the heart rate that achieved the most or the highest level of fatty acid oxidation. when we try to find that, right, we're looking at 129 beats per minute. So that's anywhere between here and 143. That's it right there.
Okay.
So if you want to improve your oxidative capacity, this is where your heart rate and your intensity should be.
Okay.
So what's nice is that it tells you the incline that was used and the speed that was used. And that should be pretty close at reproducing that same heart rate intensity.
That's neat.
Right?
Yeah.
So that's how we program based off this now. Right? And this is just the raw data of this graph here.
Okay.
You can see percent fat. We try to find the highest amount, 94, 95%. And yeah, that's about probably very similar stage to this one.
That's fine.
Yeah.
So I guess it's really, I shouldn't be worried about the number. It's really just looking at this graph and trying to maximize, push those purple bars.
We'll put it this way. Remember the research that we spoke about earlier?
Yeah.
So that is based off just the number.
Yeah.
Right? So the number does carry some importance, but it depends what you're using this test for.
Yeah. It doesn't take into account like the muscle mass.
Yeah. And it also doesn't take into account what distribution, how good your fatty acid oxidation capabilities are, or your carbohydrates capabilities are. So one of the things that we often see more common mistakes that people commit when they're trying to lose weight is high intensity interval training.
Yeah.
What heart rate do you think that falls within?
Up here.
And how much fatty acid oxidation is that?
It's like 0.
Right? So we need to get better at fatty acid oxidation before we start increasing intensity. High intensity interval training will improve your VO2 score.
Yeah.
That's good for this because we're essentially maximal oxygen perfusion. How much more can we utilize? That's interval training, high intensity interval training, versus what we're trying to improve in most cases, which is just this component here. You don't need to go to failure for that. Right? This is actually a very low pace of cardiovascular exercise. To walk at an intensity where you're able to have a conversation, but the person you're conversing with will know that you're exercising. Okay. And you should be able to do this for more than 2 hours. That pace.
Oh, 2 hours. Okay.
So, that's like a brisk walk where you can talk the whole time, but they know that you're exercising. Okay. And that's Dr. Atias. Now, the 2 hours is important because if you can work at that intensity for 2 hours, chances are you're using a lot of fatty acid oxidation, right? So you're still probably within here. Once you start to tap into between these two columns, that's not fatty acid oxidation as much anymore. Now you're leading more into glycolytic, lactate production, and that's when you start to fail. Up now?
When I saw my masseuse, he talked about how my thoracic is kind of rotated.
Okay.
So I wonder if that has to do with anything.
Repetitions than quantity repetitions.
Yeah.
If I say 5 minutes and you're in a rush, right? I'd rather you do 30 seconds of intentful movements. So hold the position, squeeze and breathe.
All right, hey guys, I'm here with Dr. Ragoza. He is the elective coordinator for the 2 weeks that I'm on, and I'm loving it right now. I'm just gonna ask him to explain what these 2 weeks are and what kind of specialties that people can expect to be shadowing, and maybe like why is it beneficial for us as MD students to know more about the other therapies available.
Hey everyone, so Dr. Ragoza, I am the coordinator for the Interprofessional Education elective. Fantastic elective. The whole purpose is to help students bridge the gap between being a student and then being a practicing physician. You're going to be in touch with a variety of professionals, chiros, physios, naturopaths, and everybody comes from all different experiences. So the point of the elective is essentially to teach about professions that you may not know about. If you come from a particular city where you've never had any exposure to chiropractic, for example, right, we can allocate a chiropractor for you to shadow, learn about their approach, learn about what chiropractic is, and how you may be able to collaborate in the future. The intent is to improve patient outcomes at the end of the day, right? That's what we're all doing, what we're doing. And so by understanding how you can collaborate with different practitioners, you're able to better refer, you're able to better communicate with them and understand what someone may be good for and for what purpose. And so we're getting a lot of positive feedback. Students seem to really learn from hands-on and visual experience through observation. And so, yeah, it's a fantastic elective, especially if you just don't know what some of these professionals are doing, essentially.
There you go. Highly recommend it. I'm only at the end of the first week and enjoying every single day of it, learning so much. And so for you future med students or med students that want to think about this, go for it. You're going to learn a lot. So I don't think I mentioned this, but after that treatment that the chiropractor Dr. Rigoza did to me, I feel a lot better. It's crazy how, with some of the techniques that he used, how it improved my back pain. He gave me some exercises to strengthen muscles, so I'm going to do that. Very thankful for spending time with him. He allowed me to do a VO2 max test the first day, and today he assessed me just to give me some pointers on how I can improve my fitness and health. And yeah, I wish I could spend a month learning and talking with him and practitioners like him. But now it's time to be home, enjoy the nice sunny day, maybe go outside with the dog and Nala and Jess, and then work on my application. That's Nala. There's Nala. Hey Nala. Yeah, it's me. Hey, your baby. Hey, baby. Oi, oi. You fell. Hey. 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 Putty. All right, I am running late. I have to leave to go to the Integrative Medicine Clinic to work with Dr. Junik again. Here's a little pooch she brought in. She's been complaining and hates being home alone, but such is life. So let's go. Hopefully I can get you some clips and talk to Dr. Junik. Hey, I'm here with Dr. Junik. For the past week, I've done one session in her other clinic where she does trigger point injections, acupuncture, and then 2 days here doing integrative medicine. So I'm going to flip the camera so that she can introduce you guys to what is integrative medicine, what is functional medicine, and then just why people should at least be aware that this approach to medicine exists.
All right, so hi, I'm Dr. Adrienne Junik. I have been in practice for about 8 years, and in that time I pursued education in integrative and functional medicine. I also am the unit coordinator for the integrative medicine unit at the University of Ottawa Medical School for second-year students, so I help bring that concept to the medical students to help them understand what these terms are. So I'm glad you asked that question because it's a really great question to ask because not all people are really familiar with what these approaches are, and some people wonder if they're different or if they're the same, and kind of the answer to that is a little bit of both. So if we're going to talk about integrative medicine, the goal of integrative medicine is to approach a patient from a holistic perspective to understand all the contributors to their health, and that could be embracing all of conventional medicine practices while also acknowledging the importance of diet and lifestyle practices, exercise, stress reduction, mindfulness, and incorporating natural health interventions such as supplements, vitamins, or herbal products, and also even kind of the holistic whole body aspects like yoga, mindfulness, and the interprofessional aspect of chiropractic, physio, massage, and a lot of other allied health providers. So it's about encompassing health in a much broader way and always doing that with the patient's goals and values in mind to help them navigate the healthcare system in a way that they see fit that's best for them. Functional medicine is a little bit different, but there's a lot of overlap. The way I introduce functional medicine now is the general explanation is functional medicine is a way to look at the human body and try to understand the root causes of what causes disease in the first place. Mm-hmm. So while we take the functional medicine, we take the diagnoses that a person has and we actually just put them aside and we recognize that they are important, but we also ask the question of why the person has those diseases, if there could be underlying physiological imbalances that are contributing to one or more of the diseases together. And another really important part is to understand the timeline of how a person got to where they are now, because sometimes that is a really important piece of telling us where a person got sick, what was going on there, and something that we need to address. And so while functional medicine is this really new and innovative way of looking at medicine, I like to use the analogy of the 6 blind men and the elephant. And if you don't know that analogy, I suggest you go and Google it, because things will kind of make sense there. Because the integrative medicine focus really builds upon the approach that conventional medicine offers with all of the organ systems and the specialties and the diagnoses we have, and looks at an evidence base for how we can bring in holistic care to patients with those conditions. Functional medicine, on the other hand, is like a way to look at the body from a different way and kind of try to find the answers in using a different system and a different way of thinking. A little bit like Ayurveda or traditional Chinese medicine, which are really, really old systems, but functional medicine is actually very new. It was built in the 1990s. It's actually based on anatomy and physiology and biochemistry, the same principles that we actually use in conventional medicine too. So that's a little bit of more of a long-winded answer, but I hope it puts a couple of those things together.
Great.